All right. Harry, thanks for joining me on this live stream. Harry had just signed up for a one-on-one chat with me. And when we started, he asked if we were going to record. I said I hadn't been planning on it, but that if he wanted to, and if he wanted to go live, I would certainly be happy to. And he did.
Yeah.
So Harry is, again, just someone who signed up to speak with me about, navigating treatments around jaw expansion. He's going to present his case. Harry, tell us a little bit about your story and where you're at, what you're looking for, and yeah, give us
Yeah.
the elevator pitch.
So basically, when I was about 12 or 13, I got traditional orthodontics, and they recessed my front jaw, or both my jaws. They pulled my front teeth back, and then when my lower were straight already, but it was just to match the upper jaw that they were recessing. And I got the typical elastic bands for whatever, how long it was, a couple of months, a year. And I've on these photos, if everyone can see them, you can see the one on the left was me a couple of months before I got orthodontics. And then the middle was about a year later during the treatment. And then the one on the right was another year later after I'd finished everything. It's pretty clear to see that, the the facial profile change like night and day.
Did you also experience, Harry, at that time any change in how you felt? Do you remember any psychological changes or health changes or sleep changes, performance in school,
Yeah.
self-esteem?
Well, it's hard to say because you're at that age, and like everything does change. Like at the time, I probably thought my looks were changing just because I was getting older, or like it was a couple of years later when I actually started to realize, oh shit, like my facial profile is like getting significantly worse. You know what I mean? But in terms of school, like the whole way through primary school, I don't know how it works in America, but there's school like the first one's primary school from your age 5 to like 11, and then secondary school is 12 to 18 or 16 if you choose to leave at 16. And the whole way through primary school, I was always like, you know what I mean, like top of the class. I would have always been like the first, the top grades. You know what I mean? And when we over here we do a transfer test. So when you go into secondary school, you do a test to see which one you get into. So there's a grammar schools which are for like the smarter ones basically, and then high schools are the ones for like, you know what I mean, people who don't do the test or don't get
Yeah,
high enough in the
yeah,
test.
yeah, yep.
And I obviously done really well. I got one of the highest marks in my year in school and got into my school of choice. And then I noticed after I got braces, my grades started to fall behind. Like I just wasn't able to concentrate in class, and like I don't know, I didn't realize at the time that it was because of this, but you know what I mean. Now that I look back, it's actually kind of depressing to think about it. Like,
Did they pull any teeth, or did they just pull everything back?
no, they just pulled everything back, which
Do you have any
is
more
like,
pictures that can sort of demonstrate what happened to you in your childhood orthodontics?
yeah. Hold on. If I could open this. So I have like photo. Here's another photo just before I got braces on. You can see like my facial profile. Hold on. Present. Stop screen. Present. Share screen. Here we go.
And you were how old when all this happened, Harry?
I think it was about 12 or 13, and
Yes.
like you can see from this photo, like that's like my face fully developed, high cheekbones. You know what I mean? It, like my face grew the way it was supposed to grow up
Yeah.
until I got braces.
Yeah.
And
Handsome kid. Handsome kid. So
thanks.
this was
But
before treatment.
this was before treatment. And then a couple of years ago, I was looking into your channel and I seen everything, and I seen MSE, but I didn't want to go as I thought that was the more aggressive route to go down MSE. So I thought, I'll get an alpha appliance. There was a provider down in Dublin, which is only like an hour 45 from where I am. And
For Alf, you said?
ALF, yeah,
Yeah, so for
ALF.
anyone who doesn't know what ALF is, ALF, Advanced Light Force, um, it's a lingual wire that is
I'll actually take
it's
it
a
out and show them.
oh, you have it,
I've still
you're
got it
wearing it
in.
right now?
Yeah, I've
Oh,
still got
no
it in.
kidding.
That's one of the that was one of the questions I was going to ask you, whether or not I should just let it relapse before I get my MSE treatment.
Show me what you got going on.
So there's the top ALF.
Wow, look at there. There's an ALF, folks.
Yeah,
Okay, how long have you been wearing that?
about 2.5 years at this point. Like
Yeah.
I feel like the
2.5
orthodontist.
years, huh? Can
Hmm.
you give me a big smile so I can see what your teeth are looking like? I see a little bit of that famous ALF flare.
Yeah,
Is that what you
yeah,
feel is going on, that it's just sort of tipping
yeah.
your teeth out?
You can, but it's hard to see with the light.
The light's okay. No, you're good. Go ahead, show us.
He actually said, I was telling him that my teeth were still scalloping on the sides. When I'd have to tape my mouth still at night, so to make sure that I would like mouth or not mouth breathe. And I told him like I still feel like there's not enough room for my tongue, and like I can look at my tongue after I wake up, and you can see the teeth marks like scalloping.
Yeah.
And he says, well, there's no more bone to move it out onto.
Wow.
So
Hey, at least he was honest with you.
yeah,
You got to give him props for that,
yeah,
right? Because at least essentially what he's admitting to at that point is the ALF isn't growing any bone. It's just pushing your teeth out into the
yeah,
perimeter, to the outer boundaries of your alveolar bone.
yeah.
Right? So,
And
but good on him for being honest, because for people who don't know, Harry, essentially what that appliance is doing is it's slowly, and gently pushing the teeth through this bony area here called the alveolar bone that the teeth sit in, and it's
yeah,
slowly migrating the teeth outward in that bone. But you can only go so far. I mean, there's not that much bone there for people. There's I
yeah,
don't know, a millimeter of it, I guess. So it's not good to push teeth through that bone, but that's what tooth bone expanders like the ALF do.
yeah, yeah,
And then what happens is you wear it for 2 years like you did, and you're like,
yeah,
"Okay, well, I I maybe feel a little bit better. I have a little bit more tongue space because the teeth are tipped out, so you get a little bit of tongue
yeah,
space."
yeah,
But normally, people are pretty underwhelmed with their result from that appliance. And then they're like, "Oh,
yeah,
well, I just did 2 years of that. Now am I really gonna do an MSE?"
yeah. I was actually watching one of your videos you posted the other day while I was in work, and like it was the one where you were talking about how these tooth-borne appliances, like the first year when you get them, like it's like, oh yes, I can see my like soft tissue change. Like can start to see like a bit of a difference, and I think it's gonna like keep going. But those first few months are just like that's all you get. Like
Yeah.
there's nothing, there's no more after that.
Yeah,
And
I call that the honeymoon phase of tooth-borne expansion.
yeah, and I just resonated with me a lot.
Yeah.
And no, but
You know what it's
the
like? It's like puppy love in a relationship. It's like
yeah,
you could be dating the craziest chick in the world, right? With that, and somewhere in your rational mind, long term, this is going to be a train
yeah,
wreck. But like for the first few months, everything seems great. You know what I
yeah,
mean? And so you just sort of ignore the long term questions. That's
yeah,
kind of like the honeymoon phase of tooth-borne expansion.
yeah. And but I had the same idea as Bailey you had on I think it was a year or two ago. I was only watching it a couple of months ago, but he was the one that convinced me to get MSE basically. But he was saying he wanted the DNA appliance because that's what he thought. He had retractive orthodontics like me, and he wanted the like obviously just move the teeth back to where they were, and he thought that was going to fix it. But obviously this was years ago, so like your skull's going to change. Like it's not just going to go back to normal after you move your teeth. Like it just doesn't work like that anymore. But
No, that's right, man. That's right. By
yeah,
the time, and you told me offline that you're 22, and so at that
22
age,
next 22 next month. Yeah,
22 next month, happy early birthday.
yeah,
Um, but yeah, so you're pretty much done growing, right?
yeah,
So like
yeah,
I heard Michael Gunson, the jaw surgeon, say that he won't operate on anyone before age 22 because
yeah,
they're still growing until age 22, and you can't really do jaw surgery on someone who's still growing because that could obviously,
yeah,
you do the surgery and then things are still changing, right? But so anyway, you're 22 now. That's pretty much going to be that's it for you. Your skull is
Yeah.
in its final form.
Yeah.
No amount of tooth-borne force is going to change that. No amount of mewing is going to change that. Certainly not in the short to medium term. Maybe over a 10-year period it might.
Yeah.
But so yeah, so your options for getting bona fide skeletal change are skeletal expanders, jaw surgery, all the shit that when you first get into this space, you think it's too invasive.
Yeah.
And so you do the AL for the DNA because it's less invasive, right? It's
Yeah. Yeah.
epigenetic, which is horse
Yeah.
shit.
Yeah. I know. Yeah.
So,
See,
but here
I
you
would
are.
be in, yeah. So I would be into like sort of diet. I would like the guy you had on Oscar for. I would eat similar to him. So I sort of thought like, oh, if I eat my diet right, I get the alpha plants, everything natural. Oh, my jaw is just gonna go back to its good like natural state. But nah, it just doesn't work like that.
No,
Unfortunately,
man.
like,
No, it
but
doesn't work. It doesn't work like that. There's nothing natural about an ALF.
yeah, yeah,
There's nothing natural about a DNA, even though, bro, they literally call it DNA to
yeah.
to
It's like
give
a
the
marketing term. Yeah,
idea like, oh, this is having
yeah.
some sort of genetic influence on you. Are you having a beer?
No, it's an appetizer. It's just apple juice.
Oh, that
um,
must be an Irish thing. I've never seen that before.
oh, serious? No, it's just like sparkling apple juice, nothing else like in it.
That sounds
So
bomb, man.
yeah. But anyway, I
Yeah,
wrote down
tell
a
me.
few
Yeah,
things. I
tell
wrote
me
down
what
a
you
few.
want to talk about.
So I was said before and after braces, posture change. That was another thing I wanted to talk to you about. I remember when I was like maybe like over here we call it like second year, third year. I remember people starting to say to me like, "Why are you starting to point your toes out like this? Like, like duck feet. You know what they are like."
I
And
do.
I just never thought anything of it at the time. And now I've got like a before and after, but so many before and afters.
Well, before and
Whereas,
afters are everything in this space.
yeah, yeah.
There's nothing like a
But
good before and after, right?
I have like a photo. It was my first day of school, going to secondary school, and it was towards the end of my fifth year at school. Um, share screen.
So then you would have been how old at that time? 15?
16, I think. I think it was 16, and you can see like obviously my facial change, my chin's pointing up because obviously they pulled my jaw back into my throat. So you have to tip your head to compensate. And then I feel like the whole body, like it's all connected, like your knees, your feet, your toes, everything like
Yeah.
all comes from that
Yeah.
damage that the retractive orthodontics done. I don't know what
Yeah,
your
man.
opinion,
So
but
so I'll say a few things. So the
yeah,
posture that you have in the photo on the right. By the way, I would
yeah,
say this is the most striking before and after that you've shown so far because the kid on the left looks
yeah,
sort of bright-eyed and bushy-tailed, and then the kid on the right definitely has some sunken in facial stuff happening.
yeah,
Um, I don't know. This Chris T, this is live. This is live,
yeah,
brother. Um, the posture on the right. So this could just be like almost like a cool kid slouch that you're doing here, right? Because
yeah.
I remember when I was in high school, you kind of want to like be cool, and that's sort of like how like a rapper might stand or something. You know what I mean?
Yeah,
So there could be a little bit of that going on there. In all fairness, it might not just be bodily collapse.
nah, this is like the way I sort of stand naturally now. Like it's still to this day, like my toes like point out a lot. Like my girlfriend always says to me, like you're standing like this, but like I try to like point my feet in like not like this, but it's just not natural to me. Like I just want to go like this with my feet, and I think it's all to do with from your jaw posture, your head posture, all the right way down. I think it's all connected, to be honest.
I will comment on that. I would
Yeah,
say I 100% agree. I built my channel on that idea. My blog
yeah.
used to be called Migraine Hacks. Before it was JawHacks, it was Migraine Hacks.
Oh, I
And
didn't even know that. Yeah,
the whole foundational idea behind Migraine Hacks was that when you have small jaws, you have that forces chin forward nerd neck posture
yeah,
because nerd neck posture opens the airway in
yeah,
spite of your small jaws. the nerd neck then causes your shoulders to roll a little bit.
Yeah.
And then your shoulders rolling then sets in motion a chain effect that goes down to your hips, where your ass kind of goes limp,
Yeah.
right? And it sort of falls flat, and then you look like one of those guys that has no ass. Is
Yeah.
that do people like tell you that you have no ass too?
No. To be fair, like I've always been going to the gym. That I thought the gym maybe caused my duck feet, to be honest, at the start. But then now that I'm like getting into the orthotropics stuff, like I've actually realized no, it's not the gym. It's not from squatting. It's from retractive orthodontics. Like
Right.
I obviously go to the gym, so I have a bit of muscle mass, so that people won't say you've got no ass. Like if anything, it's the opposite.
No kidding.
Yeah.
I mean, when I think of the feet and how the feet are, whether they're flat or whether they have good arches and whether they're
Yeah.
pointed out or in or perfect, I look at the glutes, I look at the ass,
Mhm.
because generally the feet follow whatever's happening in your glutes.
Yeah.
So what are your thoughts on that? How do you feel like your glute strength is, and core strength when it comes to holding up your posture?
Yeah, I don't think it's a problem. I go to the gym 3 days a week. I like do all the strong lifts, bench, squat, deadlift. Well, I've actually stopped squatting and deadlifting recently because I'm starting to feel like it's not worth the risk, if you know what I mean. The risk reward ratio isn't right because it's like tearing down your body. Like when I was 17, actually I squatted like 200 kilograms, which is like I don't know how much that is in pounds in America, but
Yeah, it's a
same as
lot.
deadlift. I deadlifted 200 kilos. But obviously that's sidetracked a bit. But I don't
Yeah.
think that's a problem.
Well, are
Yeah,
you able to correct your feet then? Like, are there certain muscles you can flex? And like, if you're conscious and mindful, are you able to like correct that? Or is it just totally out of your control?
I can correct it if I think about it. It's the same as like breathing through my nose. If I sit and think about it, I can do it, but it's not natural to me. I still have to tape my mouth at night. Like I think that's all linked in.
Yeah,
To be
I do
honest.
too. I do too.
Yeah,
So I would agree with you, man, that when you have jaw deficiency, it then flows downstream to your neck, your shoulders, your hips, and
yeah,
down to your feet. It's obviously all
yeah,
connected. Um, I've always said there's a lot that you can do to improve full body posture, even with small jaws, but it's
yeah,
always going to require mindful effort. It's never going to become habitual because your body will always prioritize
yeah,
breathing.
yeah,
Breathing is the prime directive, and you'll always resort to that kinked nerd neck posture to open your airway whenever you're not paying
yeah,
attention. And then that's going to have a downstream effect on your posture until you fix
yeah.
your jaws.
Yeah. Well, see, I was talking to my mom about all this, and she like just before I was going for this, like coming upstairs, I was telling her I have a consultation for MSE, and she's like, "Oh no, you don't need to get this. Like it's too. You know what I mean? It's not. You don't need it and all." But like, she doesn't understand like the way that the effect it has on your brain, everything. Like I just like I wish I had known about this earlier because like see like the whole way through school and everything, like I could have had better grades, easier to concentrate, like. I don't know. I just notice a difference when I tape my mouth at night, and then when I forget to tape my mouth, like I just wake up. I feel more invigorated. Like I don't have most of the time. I find it really hard to actually get up in the morning, and I always thought that was it was just the way I was. But then I remember back, I never used to be like that, like until I got braces. So I think it's going to be 100% worth it then, like in the long run. So yeah,
So at age, you're 21 turning 22.
yeah,
I would say, bro, this is the perfect time for you to do this stuff.
yeah,
It's by no means too late. Yeah, could your teenage years been a little bit more ideal if you breathe better and sleep better? Of course,
yeah,
but it sounds like you've done
yeah,
okay, man. I mean, like some people are commenting, you're a good-looking guy. This guy says, Harry,
yeah,
you don't even look that bad as of right now. I would phrase it differently. I would say you look good. I mean, you have a nice
yeah.
smile. Yes, your maxilla is a little bit recessed. You almost have a little bit of like that class 3 sort of look where the
Yeah,
upper jaw is sunken in a little bit.
that was one thing I meant to say to you that I know you hate when people say this, like, oh, I feel more comfortable when I bite like this, and I honestly think it's true. Like, see, I was actually joking. My girlfriend was joking about with me the other day. She was saying, "Oh, I have a better jawline than you." Like I'm like, she has like she's from Poland, so like she obviously like over there they're like they're brought up more naturally than like us in the West. Like they're breastfed and like longer, better food,
Yeah, and
and
they
like
don't pull teeth over there.
yeah, they do. Well, she's been living here most of her life, like so that wouldn't be the the cause. But when I was like, I was going like this. This is like when the back of my tongue can't sit on like on the roof of the mouth. I don't know. It's because I think my upper jaw needs to come forward so my tongue can slide forward. If that makes sense. Like I think it's like this. So my tongue needs to come forward so that I can like be still class 3, but it's hard to explain. I sound a bit stupid trying to talk about it, but when when you like look to the side and you're like this,
Mm-hmm.
you like it sort of looks like flat, like fat here, but it's not. It's just your tongue sitting too low. I
Yeah,
feel like
yeah.
I feel like I need to get face mask so that I can like basically move my jaw a couple of millimeters forward so my tongue can slide up and be in its natural position. Because I think it's not actually well, obviously I need a bit of width in the expansion, but I actually think it's like more vertical. I need to come forward. Expansion, like obviously I need expansion horizontally, but I also need forward expansion to like so my tongue can like slide forward. If that makes sense.
Mm-hmm.
Sort of, yeah.
Yeah, of course that makes sense. And I think a little bit of face masking with your Marby might be appropriate.
Yeah,
Obviously, you would have to ask the orthodontist who was treating you if they think that's something they're going to be
yeah,
willing to offer to you. But what you're describing is what I've often called a skeletal class 3, which means
yeah,
that your occlusion is not in a class 3. When you bite down such that your
yeah,
back teeth are touching, your upper front teeth are in front of your lower front teeth, which
yeah,
means you're
yeah,
not technically a class 3. But when you bite in a way that's comfortable for you and that feels
yeah.
better for your airway and that feels better maybe for your TMJs, you end up in a class 3.
Yeah. I feel
So,
like before I got the alpha appliance, it was like way out. Like I was like, oh yeah, I feel comfortable way out here, but I think I have got a bit of expansion, and it has brought my whatever my bite slightly forward. So like I feel like my most comfortable bite would be about here. That's
yep.
where I feel like that's where my mandible needs to be. My TMJ joints need to be about here, like to
That
be.
feels best for your joints or that feels best for your airway? Like, does that really feel like a sustainable position for your joints?
It's hard.
Or
I feel like it's malleable because it's like it feels best for my airway, but also like when I stand up straight, I'm trying to think about good posture and I reposition my jaw. This is where it, this is
yeah.
where it feels like I should be biting. If I'm sitting, if my spine is straight as I want it to be, that's where. So I don't know how many millimeters that would be, like that
It's
I
not
need.
much, man. I mean, that's not unreasonable at all.
Literally there.
I mean, it's that's fair, right? Like
Yeah,
you're not saying to me that, "Oh, you wanna be here, right?" And that's like,
yeah, yeah,
first of all, that's dislocating your lower jaw forward. That's not a
yeah,
sustainable position, but to be honest with you, man, I'm the same way. Like for me to be comfortable, I'm like right here. Like if I'm just
yeah, yeah,
same as you,
yeah.
pretty much.
Yeah, I think a lot of people are like that. People who have had retractive orthodontics and got the elastics and everything on. But yeah,
Yeah, we certainly are like that, a lot of us. And I find myself unconsciously when I'm exercising or when I'm doing anything, my lower jaw just sort of falls forward.
yeah. But um, I better move on to MSE before I run out of time. Like,
Yeah, go
so
ahead.
I had a I have a consultation booked for the 18th of June with a provider in Dublin. He actually I rang them a couple of times, they wouldn't answer, and I left a voicemail. They didn't get back to me, and then I rang them again a couple of days later, and they said, "Oh, sorry, we don't take anyone like internationally." And I says, "Like I'm literally an hour away. I'm just across the border," and they're like, "Oh," and I was like, "And I'll be down in Dublin anyway on this day, so." and they're like, oh, okay, we'll book you in for a consultation. It'll only be 5 or 10 minutes. So obviously, I don't know anything about this guy. I know he's got a YouTube channel. He's posted a video about MSE, which like is just like he's basically showing other dentists how to design it. And I found him. He's He's on the One Moon map. You know, if you go to try and look for MSE providers.
Yeah, I'm familiar with
But,
that map. What's his name?
Dr. Vishal Vij, I think.
I think I've heard of him.
Yeah, because obviously I booked this consultation with you because you have the most knowledge about MSE providers. You know how to vouch for, and like who you don't like know anything about. And my worst fear is getting asymmetrical MSE. Like, you know
Smile
what I
for me,
mean?
Harry. Let me see your smile, dead nuts on the camera. Yeah, you got
Yeah,
a pretty symmetric bite to begin with, right?
yeah.
So
Well,
go ahead.
and I noticed when we flipped from the last straight call to this stream, I noticed it like changes opposite. It
Oh,
was
it
like a mirror
mirrored you?
effect. Yeah, so I noticed like this asymmetries like right away. But no, a couple of months ago on my Alf, I was eating and I didn't want to take it out, and I was eating and I bit down in the Alf, and I think it like slightly tipped one of my back molars out.
Oh no.
And I said to him about it. He says, "Oh no, it's fine. It's negligible." But I know when I was watching the video with Dr. Ilya Lipkin, he was like saying it has to be like, you know what I mean, dead on. The screws have to be exactly straight. So I'm wondering if because one of these molars are tipped, will it make my MSE like more likely to be asymmetrical? If you know what I mean?
I think that it's not so much any one tooth being tipped or crooked that determines whether the MSE is going to shoot you straight or whether it's going to
Yeah.
be crooked and asymmetric.
Palate.
I think what really matters is that the bite line in general is flat. I think your bite line is pretty damn flat. Is it perfect?
Yeah.
No. Do we all have some asymmetries? Yes.
Yeah.
Is it a question of degree of asymmetry that determines whether the MSE is like potentially going to blow you up into one of these horrible asymmetry
Yeah.
cases? Yeah, it's a question of degree. And I think, relatively speaking, you're pretty damn flat in terms of your bite line.
Yeah.
And
Yeah.
actually, the best way to tell that is with your mouth closed. So close your lips and look straight on the camera. Yeah, man, that's pretty straight. I don't
Yeah.
see a significant cant there. So as long as the provider doesn't royally screw it up and
Yeah.
design or place the appliance crookedly, you
Yeah.
should be okay. Show me the roof of your mouth, Harry. Before we go too much further, I just want to see what we're actually dealing with in terms of, not the narrowest palate either, bro. I mean, yes, there's some teeth tipping from the Alf, but
yeah, it's the tipping from the Alf. That's what I was going to ask you, because I know they like see once I take this out and I leave it out for a day, maybe I put it back in, I can feel like the tension. You know what I mean? It's ready to recess, like it wants to recess. It's just tooth-borne expansion. I just
yeah,
wonder, should I just take it out now? Like if I'm going to get MSE, should I just?
bro, I would say before you do anything drastic like that, just chill until you meet with the doctor who you're eventually going to work with on whatever comes next,
Yeah,
and let them make that call.
yeah,
Because you know what, you can always pull it later, but once you
yeah,
pull it, you're right. You are going to set in motion a series of events of those teeth sort of coming back to center. And
yeah,
maybe that's what's going to end up happening. Maybe they're going to actually prescribe that before they do anything, you have to take the alpha out for 3 to 6 months. By the way,
yeah,
that's happened to me pretty much
yeah,
before every appliance I ever did. They were like,
yeah,
oh, before I treat you, I need you to come back to homeostasis, and you do that by emptying your mouth for 3 to 6
yeah, yeah,
months. But I don't want to be the one to tell you that. And I don't
yeah.
think
I
it's
know
doing
what you
any
mean.
crazy harm right now. So I would say just chill on it, let it be
Yeah,
until you make that relationship and have a treatment plan.
yeah, because I just it's the waiting game. I would rather get, everyone's like, oh, they want to get it as soon as possible. I want to get my MSE tomorrow if I could. Like, obviously, I know I'm gonna have to wait an extra 3 to 6 months if I like have the Alf and have to let it relapse. But it is what it is. You know what I mean?
Yeah, bro.
Um,
There's no super urgency here for you. Like,
yeah,
this isn't like 3 to 6 months is nothing in terms of the
yeah.
time scale that you should be thinking in terms of.
But I was actually planning to take a couple of months off work so I could wear the face masks 24/7. I'm gonna go absolutely like well, obviously everyone's like this on paper. They're gonna want to wear a face mask. I'm gonna wear 23 hours a day. But that is my plan, just to maximize it. while the suture's open, just absolutely hammer it basically
Damn, man.
with the
Yeah.
face mask.
Did you see my call with Ethan the other day?
I did. I ended up watching like 20 minutes of it maybe because I was like ready. I was watching it while I was going to sleep. So
Yeah, yeah, he's going pretty hard with the face mask. Do you have any
yeah,
plans for what do you plan on using for a face mask?
you see, um, over here, I think you said it's only in America they have the bow and the other one that goes around your neck.
The crane.
I've actually left out. You're probably like saying, "Oh, you've got this far and you haven't told me this." So before I got my Alpha plans, I had a Schwartz plans that I got online and I wore it for like a couple of months, and obviously I realized I'm just tipping my teeth, so I just took it out. But I got a,
So you
I
went
got a,
from tipping your teeth fast to tipping your teeth slow?
yeah, pretty much. I need
I
to
had a
get some.
Schwartz appliance at one point too, bro. So
Yeah,
for
I know.
anyone
I
who doesn't
remember you
know, a
saying.
Schwartz appliance is basically like it looks like an acrylic retainer. It's an acrylic expander that has a bunch of wires in it and some jack screws, and you turn it and it pushes. It's a DNA essentially.
Yeah, yeah. So I had this. I never really wore it, but I think this is the only face mask that they provide over here. I would like to get the bow for sleeping, and the other one for just during the day, as it looks more comfortable and it's not pushing on your jaw joint. But I actually don't think it's possible over here. So
Anything's possible.
yeah, unless I paid you to get me one and ship it over to me. I don't know. Maybe that would be
Oh
possible.
man, I can't be dabbling in unprescribed
Yeah,
medical equipment, man. But
yeah,
uh, yeah, that's something you could start working on sooner rather than later, because
yeah,
it
yeah.
might take 6 or 8 weeks to
To get one
logistically make
organized.
something like that happen. But dude,
Yeah,
people are
yeah,
rigging up all sorts of crazy face mask stuff. But dude, I think the
yeah,
bigger issue with you, Harry, and this is the thing that you're not thinking of, and maybe
yeah,
I can provide some insight on this. I doubt that this Irish doctor is
yeah.
going to be willing to treat you
With face
with a
mask.
face mask or even with an
Yeah,
MSE. What I've
yeah,
seen, bro, is that English doctors and British doctors in general
mhm.
are very conservative. It's almost like they're all living in the shadow of Mike Mew,
Yeah, yeah,
um, and like fearing that they're going to get thrown into the kangaroo court with him.
yeah,
Um, and so most of the British kids that I talk to end up traveling elsewhere in
yeah,
Europe to find someone who's actually willing and interested in treating them.
yeah. See, this is what I didn't want to run out of time to ask you about other doctors. I've seen Doctor Simile, isn't it, from
Chimile.
Turkey? Chimile.
Yeah.
She seems pretty good, and like obviously she's an option. It's just whether like how many times do I need to fly over? You know what I mean? Like I looked at the flights; they're only like £350. Like nothing much. You could fly in, fly out a couple of
Yeah.
times. That's no problem. But it's just if the orthodontics afterwards, like maybe do you need to go over every 6 weeks or like
It's better to, but if you end up in Invisalign, then you could probably see
yeah,
her
ship
every,
it.
6
Yeah,
to 10 weeks, right? But
yeah, yeah,
initially though, you're going to need to see her a lot so she can keep an eye on things.
yeah, yeah,
I mean, she's not going to go looking for you, bro, but you want to
yeah,
put
yeah.
yourself in front of her because you
I
don't want to
know,
get
yeah.
forgotten.
And is there any other doctors in Europe that you'd recommend? Like I was actually thinking of going to America. Like it's the same price to fly to New York that is to fly to Istanbul. You know what I mean?
Right.
It's not the price really I'm worried about it because I know it's going to be for the rest of my life. Like so, it's like
What I've been seeing, Harry, is a lot of the European guys that I talk to are seeing Chris Moschik in Germany. As of the
Christmas.
last couple years, Chris Moschik seems to be the one who's most sort of leaning into treating adults,
Yeah,
and accommodating patients traveling from other parts of Europe coming in.
yeah,
He's expensive, but he seems to be getting the job done and with a smile on his face. Whereas
yeah,
a lot of times with guys like you who are sort of fence cases, like we're even seeing
yeah.
it
A lot of
come.
people will be reluctant to treat people like me. Yeah,
Yeah, I mean, you get,
I understand
10,
that.
10 to 10 to Medix, Harry looks fine. Mercutio, this guy looks perfectly fine. And listen, you are a fence case, right? Like you've
Yeah,
got a
yeah.
girlfriend.
I
You are a
understand.
handsome dude.
Yeah, I understand. Yeah, but obviously, I know from like it's not even just about looks, it's my health. Like it's the oxygen that goes into your brain is like gonna determine like basically how much your IQ points are, like everything like that. My sleep, my breathing, it's all linked together. My posture,
Yeah, bro,
but
you're the one living in your body,
yeah,
and it's
I
very,
know. Yeah,
you know what's going on. You know,
yeah,
you're the one who's been super mindful and super
mhm,
on top of your own biohacking journey for the last however many years, and you know that your mouth is somehow limiting you in this way. You have sleep disordered breathing, and your bite's not right, and you're having to
yeah,
cheat your lower jaw forward just so that you can breathe and have decent posture. Blah, blah. All of these
yeah,
things these are universal symptoms that most people with small jaws experience. It's just some of us
yeah,
are more mindful than others and are aware of them. But to my point though, this is
mhm,
kind of like what I suspect that you're going to get from most British doctors who you go see. They're going to be like,
yeah,
Harry, you look fine. There's nothing wrong with
yeah,
you.
yeah.
And
I
so,
understand. Yeah,
um, what I've seen is that Chris Moschik generally doesn't treat people that way where he just writes you off because you present as
yeah,
a pretty normal guy. So I would say if you strike out with this guy in Dublin, go see Chris Moschik.
yeah. So, and does Chris Moschik? I remember you saying there was a guy in Germany that has like a person that does the lower expansion for him as well. Didn't you say that?
Yes, that's not Chris Moschik though. That's a different doctor.
He sends them out. He sends his patients out to this guy. Yeah.
Chris does not send his patients out for lower jaw expansion, as
Oh.
far as I know, but there is a different orthodontist who does.
Ah, right. Okay. Yes, I
But
understand.
I would say, bro, that's not something that you're gonna want, because when you do the lower jaw expansion, that actually advances the front of your lower jaw, so that would
Oh,
exacerbate
right.
your class
Yeah,
3.
yeah. Well, that's good to know because, like, honestly, I'd rather just get the MSE. Like, but I was just like, as you say, like, you don't want it to look like balloon face. But hopefully, if I only get like a couple of millimeters MSE, I won't need the lower expansion. And yeah,
So yeah, let's stop for a second and comment on that, because I think that's a really important point for you.
yeah,
You're not a 1 centimeter expansion case.
yeah,
You're a
yeah.
fence
I
case.
understand. Yeah, yeah,
You're a guy who, like, you should get in. If you're gonna do this, get a quick
yeah,
bang for your buck, 4 to 6 millimeters of MSE expansion, and then get the
yeah,
fuck out, man. Because
yeah,
with someone like you want to make sure you don't do more harm than good, because you already
yeah,
look decent. You're already functioning decently well. You've got a girlfriend. You're lifting weights. You got through school. Like, you're okay. You're
yeah, yeah,
surviving. Don't blow your
yeah,
shit up by overdoing the expansion.
yeah. 100%. That's my goal. Was just get the suture open, like maybe like 5 millimeters, blast face mask as much as I can, get as much forward expansion as I can, because I feel like that's the thing that I need the most. And then just as you say, get out of there. Like just
Yeah.
yeah.
Yeah. Get, 5 is a good number. I would say 4 to 6.
Yeah.
See if you can address your skeletal class 3 with the face mask, and
Yeah.
then have a very discreet end game. Know where you know what would be good enough for you, and
Yeah.
then stop, bro. Because what
Yeah.
I see generally in this space is people get carried away and they think
Yeah.
more is more, when in
Yeah.
reality, too much of a good thing is too much of a good thing, and sometimes less is more. So you need to be a mature adult and not treat this as some sort of like science experiment on yourself.
Yeah.
Realize that this is just something you have to do so that you can move on with your life.
Yeah.
Harry, you have way bigger things in your life coming up than this jaw hacking stuff. This is just a vehicle
Yeah.
to get you from point A to point B. Don't treat it as an end in itself. Get in,
Yeah.
get some good results, and then dip.
Yeah. It's good advice.
Four to
But
six millimeters, a couple months of face mask to see if you can get your lower jaw a little bit more comfortable in biting in that more
yeah.
forward position, and then wrap it up, bro.
Yeah. So you think Chris Moschik? Could I get that the spelling of the second name?
Yes, Moschik.
MOSC. Thanks. Yeah. And do you know roughly how much that like it's gonna be? It's not really a problem, but like
Well, I do, because someone just told me about his pricing. I heard it was
yeah,
16,000 euro,
yeah.
which is, so to put that in perspective, if you were to go
But
see Ice Chimile, who,
yeah,
by the way, I don't think that's a bad idea. I love Ice
yeah,
Chimile.
Yeah.
She would be probably half that.
Yeah. Yeah.
So maybe you should see both, Harry,
Yeah.
and feel that out.
Yeah.
Because listen,
100%.
8 grand is 8 grand.
Yeah.
It's nothing to sneeze at.
Yeah.
For me, 8 grand is a lot of money.
Yeah.
So, and
Same
I
as
do.
me, but I'm not saying like, oh, it doesn't matter. I have plenty of money. It's just that like it doesn't matter as in like it's long term. It's my like you know what I mean. It's gonna be with me for life. That's like your jaw. Like if it costs more to get a better result, I don't mind paying it. Like in that sort of way. But yeah,
So I'll be honest with you. I have never actually heard anything negative said about Isa Chimile in the many
yeah,
years that I've been doing this. So I
yeah,
don't think that she's like the cheaping out option.
yeah.
I just think she's like now you're traveling to Asia instead of to Central Europe, and there's a
Well,
language barrier, and
yeah.
you know what
To
I
be
mean?
honest, like Turkey's only 4 hours flight away from me. Germany's like what 2.5. It's not really that much of a difference. Like I actually drove through Germany in the summer there. I was driving to Poland, so uh, it's really not that big of a deal. Like, but
Right, right.
yeah,
Um, Another thing I often recommend, Harry, go see
yeah,
both. Since there's really no crazy
yeah,
rush, take a little extra
yeah,
time, take a couple extra $100, talk to them both. Maybe you'll find that you have a natural rapport with one of them more than the other.
yeah,
Maybe Chris Mostrick's not willing to treat you. Maybe
yeah,
Isa Chamile is not willing to treat you. Maybe they're going to say, Harry, you're fine. You're crazy. You're body dysmorphic. And we
yeah,
don't want to
yeah,
get involved with people like you because you're never going to be happy or some shit like that. Right.
yeah, yeah,
You just never know. So I would say talk to both of them and see who
yeah,
you vibe with better.
yeah. Yeah, that's sounds about right. But I've always found you better telling them the health, like when you're trying to basically get an orthodontist to treat you, you're better telling them about like say like it's to do with your breathing or like my bite and everything rather than telling them, oh yeah, I don't like the way my cheekbones look. If that makes
Well, that's
sense.
definitely true, bro, because these
Yeah.
are these are
It's something like,
doctors.
oh yeah.
They're
Because
not
when I was
these are not cosmetic surgeons. So,
yeah,
on paper, according to the standard of care, they're only really allowed to use these procedures to treat, well, really occlusion issues, because that's what
yeah,
orthodontists
yeah.
do is they fix malocclusion. But
Yeah.
maybe if you stretch it, airway problems. But
Yeah.
definitely, these appliances are not on paper made to treat cosmetics. So
Yeah.
you do have to choose your language carefully. Otherwise, you end up shooting yourself in the foot.
Yeah. I noticed that because when I was doing I think I actually got rejected by an orthodontist when I was trying to get my alpha plans. There was a guy actually in Belfast that was doing it, and he says, "Oh yeah, whatever." He said, "I would like to treat you, but I'm not going to be in this surgery for very long. Don't tell anyone that." But I think he basically just didn't want to treat me. You know what I mean? He
Yeah,
knows a
and
bit.
he let you down
Yeah,
nice.
yeah,
Yeah, well, that's nice of him, right?
yeah.
And hey, you don't wanna work with anyone who doesn't wanna work with you.
Exactly. Yeah, hundred
Um,
percent. And
so yeah, go ahead.
do you know anything about Vishal, Dr. Vish or anything? Like you've heard any if he's no.
I'm telling you, man, I really don't hear often of people getting treated in England, Ireland, and Scotland.
Yeah. I know
Right.
he's just what he was on the One Moon website, so that's the only way I knew about him to be honest. There's no Reddit forums, there was no anything on Google, YouTube.
Yeah,
But
and the One Moon list is not super reliable. A lot of the people on that list, when you end up contacting them, you end up striking out. They don't use it
yeah,
anymore. They tried it once, ended up on the list, and then
yeah,
didn't like it. Too messy. A lot of doctors start using MSE and then quickly abort it because it
yeah,
brings too much uncertainty to their practice.
yeah. I understand, yeah.
Harry, just for good measure, though, why don't you bring us home and just like remind? Because a lot of people are commenting, like, "Oh, Harry, you look fine. Oh, Harry, your concerns are, superficial or insignificant.
Yeah, yeah.
They don't think you need anything." What are you doing this for? Like, what what's your ideal outcome from all of this?
Well, obviously to sleep better, to perform better during the day. I feel like my intelligence has taken a hit from getting orthodontics done in the first place. As I said, I was always like top of the class in primary school up until I got orthodontics, and then my grades just started going like this. And like I never actually I don't know. I never actually put it down to the orthodontics, but now that I'm looking into everything, I seen your interview with Bailey, and he talks about like literally everything that he said. I 100% resonate with, and like I don't know, it's just you. Nobody would understand. Like you understand yourself better than anybody else, and if you want to like bring up them photos again in case there's people in the live that haven't seen them, you know the maybe that even before and after picture.
Yeah, this is the only one I have still because
Yeah,
the other ones have stopped sharing.
yeah.
Yeah, so in Harry, they want to know, did you have extractions done when you were a kid, or was it just retractive on what was already there?
No, it was just I feel like they retracted worse than they should have because see my front teeth were in the right position, and then the two beside them were recessed. And instead of bringing those ones forward to meet my front two teeth, they ended up putting the brace on and pulling my front two teeth back, and my bottom jaw that was perfect, like perfectly straight bottom teeth, and they put a brace on just to recess it to meet this upper jaw that was recessed also. So I ended up getting pulled back, my lips sinking in, and then obviously I got the elastics that pulled my jaw even further.
Yeah.
So
Yeah.
yeah,
Yep. And I think I can definitely see artifacts of that in these before and after photos.
yeah.
Harry, do you want to ask any more questions or talk about anything specific before we sign off? Because I've got another call at 5:30.
Yeah. So obviously, this is not like I got my teeth tipped when I used that Schwartz expander, I think, and I
Tipped
was
out.
wondering, yeah, and I was wondering. So the way the MSE works, I know you said it brings your front teeth back when you get expansion, it naturally like brings them back slightly. Afterwards, like I don't know, it's up to the orthodontist. Obviously, I know Samile, she does it. She like brings it out with Invisalign. But would they untip my front teeth, or would that be counted as recession? If that makes sense. Like,
So, so what a lot of people end up doing with MSE is they will widen with the MSE and then they will actually do a little bit of tooth-borne advancement of the upper
yeah,
incisors. Like
yeah,
Dr. Yusefian does that. He does that in a very unique way by anchoring onto the bone and using the bone, using the MSE itself as an anchor to push those upper front teeth forward. A lot
yeah,
of people will do MSE followed by SFOT on the upper and lower to try to
yeah,
advance the upper teeth a little bit.
yeah,
Um, in general, as we all know, the MSE is a transverse expander, but not a great interiorizing appliance. And
yeah,
so it's not uncommon to mix in a little bit of tooth-borne expansion of the upper incisors
yeah,
forward with the MSE. You've already done that via the ALF in the
yeah,
Schwartz. So maybe you just run with that. Maybe you
yeah,
keep it, right? Because it
yeah,
does
yeah.
help. It does help create room for your lower jaw to come forward.
Yeah. I
So
was, yeah,
maybe all of that tooth-borne expansion hasn't been wasted for you. Maybe we keep some of that.
yeah. I'm
And
just worried about it relapsing and then the MSE bringing it back further. That's what I'm just worried about. But obviously, it's up to the orthodontist to sort that out. But
yeah,
the only
yeah,
thing, say what you were going to say there. Sorry.
I'm not sure I totally understand your concern. So you're worried about you pull the ALF, the upper front teeth relapse, and
Yeah,
then you do the MSE and they relapse even more.
yeah, pretty much. That's what I'm worried about.
What I find is, and what I have found in my own case, is that after you pull an appliance that has pushed your upper front teeth forward,
Yeah,
um, if you mew a lot, your tongue will generally hold those teeth in that tipped position, and
yeah,
your bite as well with your lower jaw cheating forward will also hold the teeth in that tipped position. So
yeah,
I think you have some forces in your favor as a mewer, and
yeah,
as someone who's experimenting with this lower jaw forward bite. That's
yeah,
probably going to stabilize those upper front teeth into that tipped position. That would be what I
yeah,
would guess.
yeah. And the only other thing I wanted to say was I'm gonna actually start documenting my MSE process on my YouTube. So if anyone wants to like follow that, I'll send it to you and then you could link it in the description maybe or
Yes, I'll link it right now in the comments. What
yeah.
is your YouTube?
Um is it I know it's just my name, but is there like a specific I pulled you up. I was watching I was watching you and Dr. Ting there.
Oh, bro, that's an OG interview from like 4 years ago.
Yeah. But I don't know. It's
Harry Kinnear.
at Harry Kinnear 2592.
At Harry Kinnear 2952.
2592.
All right.
Yeah.
Also, email that to me, and I'll put it in the link. I'm sorry. I'll put the link in the description of this video.
Yeah. That's all right. Or I could even type it here if that would help. Or I just email you my YouTube channel link.
Yeah.
Yeah, I'll do that. But
for now, I put it in the live chat, and that live chat will live on with this video.
yeah, that's perfect. Yeah.
All right, Harry.
So,
Anything else? We got 2 more minutes before I gotta sign off and get situated for the next one.
I'll just have a look at my notes, see if there's anything quick. No, that's pretty much it. It's good to talk to you, and I'll probably book another consultation. Maybe it was a short one or a long one. Maybe once I start my MSE or after a few months of it, just to talk to you again.
Yeah, bro. And
So,
after you meet with Chris Moschik and Isa Chamile, if you want to talk again, do a 20-minute follow-up instead of a full 45.
Yeah.
And then if it's booked out for a while, just email me, and I will find a custom time for you so that we can talk ASAP. Okay, bro?
Yeah, no problem. Good speaking to you, Ron.
Harry, great meeting you. Thanks for your willingness to go live and putting yourself out there. And I wish you all the best of luck, and keep me in the loop. Okay, bro?
Thanks, bro. See you.
All right. Take care, Harry. Bye-bye.
Bye.
Peace out, everyone. Thanks for joining.